Welcome, and thank you for joining us today for the Science and Technology Library section from IFLA, our webinar titled Health Information Literacy Panel Discussion, Content Creation During the COVID Infodemic. My name is Sandy Avila, and I'm the current section chair. Thank you all for joining us. I'd like to acknowledge the work of our Subcommittee on Professional Development for putting together this wonderful webinar and for other webinars that we will be holding throughout the rest of this year. I'd like to provide some quick housekeeping information, give an introduction to our speakers, and then provide a quick introduction to the background of the project that enabled this particular webinar. So firstly, you've noticed that the session is recorded. We'll be sharing the recording on our official IFLA section website via YouTube. I believe we'll have that link posted in the chat here in a second. Please look forward to this recording later if you'd like to go back and review any of the information provided. Also, everybody who's a participant has their mics muted and their cameras off, but there is two ways that you can ask questions during the webinar. At the top where all of the Zoom functions are capable, there is a Q&A for question and answers. Please feel free to put your questions in that area if you have any for our panelists throughout the session. We will be monitoring those and providing answers to them either during the session or at the end. We also have the chat function, so please feel free to put any questions you have for our panelists and speakers in that area as well. In addition, our IFLA section Science and Technology Libraries event page will provide additional information on other upcoming webinars and series of workshops we'll be holding for the rest of this year. Please feel free to look in the chat for that link and follow us on all of our social media panel channels. And I think I've got that link here. I can show you where those are. If you'd like to follow us, you can do so via Twitter, Facebook, and also through the web. And doing a very quick, just so that we can get started, we have so many wonderful presenters today. I'd like to introduce our moderator, Dr. Debal Kaur. He's a university librarian from Galtias University in India. Our presenters will be many, and I hopefully am pronouncing everyone's names correctly. I apologize in advance if I'm not able to get them all correct. So Dr. Sam Chu is an associate professor, Faculty of Education at the University of Hong Kong. We have Dr. Mohammed Answar Aslam, Associate Professor of Information Science and Library Management from the University of Dhaka in Bangladesh. Dr. Bhakti Gala, Assistant Professor of School of Library and Information Science, Central University of Gujarat, India. Dr. Saeed Hina Batul, Assistant Professor of the Institute of Information Management from the University of Punjab, New Campus, Lahore, Pakistan. And Prasadi Kanchana Jaya Sakara, Senior Assistant Librarian from the University of Ruhana in Sri Lanka. Welcome to all of our panelists and our speakers. A quick background on the project that enabled our speakers to provide this information to you today is coming from the South Asia chapter, ACES, and has been granted the ACES Special Project Fund of $7,000 for the year of 2021 to 2022 on the project dealing with COVID-19 and saving people's lives in South Asia, areas and beyond. It's a health informatics promotion project. The chapter has set up a YouTube channel to host multilingual videos for disseminating awareness on a variety of topics on COVID-19 in the South Asia region. We have collaborated with the Asia Pacific chapter and European chapter to bring their experiences in dealing with similar viruses in the past. Through this channel, we propose to help in fighting misinformation and disinformation regarding COVID-19, information by citing accurate and reliable sources of information. So without further ado, I'll stop sharing and let the panelists take on their important information they like to share. Thank you again for attending today.
Thank you, Sandy, for giving the background about the COVID-19 ACES special project and nicely introducing all of us. Thanks IFLA Science and Technology Library sections and organizers of this webinar for inviting me as moderator. The organizer has chosen a very important and timely topic for this webinar. This is a very difficult time and situations we are facing since last more than 2 years all over the world. South Asia chapter of ACES has also done a tremendous job by fighting misinformation and disseminating videos and other way in local languages about the COVID-19, what to do. As informed by Ms. Sandy Avila, these webinars panelists from 5 different Asian countries will assist, and support the community people's fight against the COVID-19 in local languages. After discussions, a question answers will be done, and please send the questions through question and answer box. Without wasting much time, I am asking first round of questions to all the panelists. You may please reply one by one. Be a brief and precise, should be within 1 to 2 minutes each. What is the current COVID-19 situation in your country? May please start with Dr. Sam Chu.
Hello, okay, thank you, Dr. Carr. Yeah, so I'll share screen now. Okay, good evening, everyone. Now, so the situation in Hong Kong, okay. Now, well, today we had bad news because we just broke the historical high. So the last historical high was last year in June, but just this year we just broke it. With more than 300 new cases. Although perhaps comparatively speaking to other places with a similar population like Singapore, then actually the situation in Hong Kong is still not too bad. Now, and then this is the total number of cases since about 2 years ago. So around 15K. So it's actually really not too bad. And then the vaccination in Hong Kong has been pretty okay. Population with first vaccine dose close to 80% of the population, and with the second dose 72%. So it's not bad, actually, not bad. I guess perhaps that's everything I'd like to share for now. Thank you.
Next, maybe Muhammad Anwar Islam.
Thank you. Can you hear me?
Yes.
Okay. So at present, the situation of Bangladesh, if I refer the site of like government website, Directorate General of Health Services, DGHS, the recall, and the Institute of Epidemiology, Disease Control and Research, IEDCR. So the highly contagious variant of COVID, Omicron, peaked a spike from the end of December. And at this moment, daily over 10,000 people got infected, where the positivity rate is like over 20%. And till March 2020, the total case confirmed is like 1.8 million. And death stands over like 28,000 in a country. And 57% people got first dose, and 30% people got second dose, and 2.8% people got the boosters. But the total number of population is over 167 million. So you could easily imagine like how low the vaccination rate in Bangladesh here. And at this moment, all the educational institutions and some certain organizations are closed, with some sanctions are imposed, which will continue till 21st of February. So at this moment, this is the update I have from Bangladesh.
Thank you. It may be from Dr. Bhakti Gala from India.
Yeah, thank you, Debal, for giving us this opportunity. India is currently, of course, just like my counterparts from the South Asia region and globally, we are experiencing the third wave led by the Omicron variant. Today's, of course, figures were a single day rise of almost 1 lakh plus cases we have, and statistics and data from multiple government agencies, news agencies, both non-governmental and governmental, indicate that the number of positive cases seem to be reducing now compared to what they were last month. And although, of course, it was predicted that India would reach almost 8 to 10 lakhs per day cases with this Omicron variant, but thankfully, we would say that it's not reached those levels. And this wave, which began in December 2021, has had a peak of almost 3.5 lakh daily cases, which was seen in January. And some of the leading agencies are saying that we are now in the community transmission stage. And this is low compared to what we experienced during the Delta variant, with a high of almost 4.14 lakh cases per day. According to official figures, of course, India's overall number of COVID infections has reached a total of almost 41.95 million. We are the second highest behind the United States. And of course, the current numbers are partially also low due to massive vaccination drives, which have been carried out by the government of India, with almost 3/4 of the 939 million adult population vaccinated with the mandatory two-dose regimes. It has also been reported that many infected people currently are also reluctant to get themselves tested or are using the self-testing kits available in the markets. So although nowhere near the mark of the second wave, we still are experiencing deaths. Currently we have 1,000 deaths per day as against 4,000 deaths per day, which were observed during the second wave. And of course, our total death count as on 4th February yesterday is almost 5 lakhs, which is very high. And although there are some analysts which are claiming that millions more have gone unaccounted, most cases of the Omicron variant, which we are right now seeing, are mild, although hospitalizations and cases in intensive care have been increasing for patients with pre-existing comorbidities. And our chief apex body, that is the ICMR, Indian Council of Medical Research, has forecasted that this third wave might ebb by March in India. That is all from me. Thank you.
Thank you. May I next Dr. Sayeda Hina Batul from Pakistan?
Thank you. Thank you, Debil, and good day to everyone. First of all, I would like to take the opportunity to say thanks to IFLA STL Professional Development Committee members who organized this very timely webinar and who provided us the opportunity to connect internationally. So as far as the situation of COVID-19 is concerned in Pakistan, is getting again worse. As we are experiencing the 6th wave currently. In the past, it was at the peak in the month of April and again in the month of August in 2020 due to Delta and other variants. However, recoveries are more than that, which is a good sign. As far as today's statistics are concerned, so today the positivity rate is 9.67% in country, and total deaths per day are 28. So there are more than 1,600. There are more than 1,600 people who are in critical care in the country. The cities where infection rate is more than 10%. Government implemented some of the restrictions. For example, indoor public gatherings like dine-in in restaurants, marriages, and other public gathering events are restricted. And the children who are under 7 years old, they are only allowed to attend 3 days a week. The other 2 days they are staying at the home. And the universities and colleges are open 5 days a week, but the students are allowed to enter in the varsity by following strict SOPs. And only vaccinated students are allowed to enter in the campus. So government is following applying strict SOPs on controlling the situation. As far as the other details are concerned, so government is also doing taking the precaution measures by applying or implementing smart lockdowns in the areas where the positivity rate is very high. In the country, the spread of the disease, specifically this Omicron variant, is very fast. However, the symptoms are minor. But it is more in cities where definitely there is a dense population, and it is also very high in neglected areas of the country where people are not vaccinated and they have their fears and myths in their mind. So they are not going to be vaccinated. Even the government announced the boosters for the overall population. So this is from the Pakistan side. Thank you, Debu.
Thank you, Dr. Hina. Now, Prasadi Kanchana Jayashekara from Sri Lanka. You can say just 1-2 minutes.
Yeah. Hi, everyone. During past 2 years, due to the COVID-19 outbreak, the Sri Lankan government imposed several island-wide lockdowns and travel restrictions. There have been around 613,000 infections and 15,492 coronavirus-related deaths reported in the country since the pandemic began. According to the Health Promotion Bureau, the current average daily new cases in Sri Lanka is around 1,200. And recently, the Director of Health Promotion Bureau announced that 95% of the COVID-19 positive cases reported in Sri Lanka are infected with the Omicron variant. Also, the vaccination programs are very successful. Now people are getting their booster doses, and 14 million Sri Lankans are fully vaccinated, which is 63.7% of the population. That's all about the Sri Lanka.
Thank you. Thank you, everyone, for giving the current COVID-19 situations. But situation is not good, and more or less in all these Asian countries are facing huge troubles. In this round, now the next round, I will ask 1 or 2 questions to each of you. You have to speak answering those questions. Each of you will get 7 minutes. Please remember 7 minutes. My first question is to Dr. Sam Chu, Hong Kong. How may you help students learn more about COVID-19 beyond the videos your team produce from this project? Dr. Sam, please.
Okay, thank you, Dr. Ka. I'll share screen. Now, before I talk about our strategy to help students to learn more about the content of our video. So let me just highlight the 3 video that I involved in. The first one, stay safe from COVID-19 without or before vaccination. Yeah, so basically I think the content is probably quite self-understood, so I will not explain the content. And then a second one led by my friend in Canada, YC Chen, and he's a designer. And then he produced 2 videos based on the topic, things to do during the pandemic. In fact, he came up with 40 ideas. And so it has part 1 and part 2. So this is still part 1, 40 things to do during the pandemic, all kinds of ideas. And then the part 2, talking about that one of the things that we can do during the pandemic, one thing that we should do is because many of our friends are probably not too happy, and so we need to show our care. We care for one another, and so this is a very good lesson for the students and adults too, I think. And then okay, now our strategy on the getting children and also adults to know about these videos consists of 3 things, as you can see here: digital story writing, competing with Socrates, viewing battle. I'll be talking about those one by one. Now, for the first one, about digital story writing. In fact, my partner Helen is the main person for that. So regarding this part, I'd like Helen to talk about it, please.
Okay, hello everyone. I'm Helen Chen, the IFLA Professional Division Committee Chair of Division F, the Vice Chair of Academy 22 Education for All Foundation Limit, and the project team member of the Hong Kong Youth Funding Proposal. Being the coordinator and the key host of the International Digital Story Writing Competition now, and the Asian Digital Story Writing Competition, as well as the regional-wide Digital Story Writing Competition in Hong Kong, I'm really grateful for Dr. Ju's invitation, and let me share with you some valuable experience of hosting the international competition for over 920th primary and secondary school students from 15 countries and regions, including Hong Kong, China, Singapore, Romania, United Arab Emirates, Pakistan, India, Sri Lanka, United Kingdom, Malaysia, Qatar, Canada, Ghana, Tanzania, and Brazil under the tremendous effort of the team members of this time. The key team members are Dr. Bharti Gala, Dr. Sam Chu, and also many important persons. Let me see. Yes, and Dr. MD Emerald Islam, Dr. Sida Hina Batu, Professor Raj Kumar Hawaj, Ms. Pesadi Jayasekara, and Mandika Lambert. Hope I have pronounced your name correct. Forgive me if I'm wrong. I pronounce it wrongly. And then, of course, including me. So thanks a lot for all the effort of the team members to make the competition running so smoothly and successful. The competition is organized by the University of Hong Kong, the Association for Information Science and Technology South Asia chapter, and the Academy 22 Education for All Foundation. Children and teams from primary and secondary will create a digital story, fiction or non-fiction, about their learning and experience regarding COVID. We enable students to write e-books about artificial intelligence and health, and honed their digital literacy, reading, and writing skills in 10 free workshops in January, February, and March this year. Experts on storytelling and story writing, digital story creation, digital artwork, visual art, artificial intelligence, and question creation from different countries will host the workshops. Dealing with COVID-19 videos are provided to the students to answer questions too. So throughout the competition process, a positive impact on the student, their family, and the wider community on dealing with COVID-19 is created, as well as promotion of STEAM education. The competition will be held online on April the 16th, and students can submit their ebooks by April the 11th. So for details, you can go to the ACES event webpage, which I can share with you, and have a look of the webpage right now. Okay. Okay, here you go. Yes, okay. So there are different challenges in coordinating an international event for kids and teenagers. Among the nearly 1,000 registrants, most of them joined the competition after the first workshop. Some of them joined after the second workshop and third. So to enable all newcomers learn the same content from each workshop and make no one left behind, all the post-workshop quizzes with the Zoom recording of each workshops were sent to them. Other than that, to facilitate many participants whose mother tongue is not English, live Zoom transcription is allowed in each workshop and will do so in the online competition. The speech of each speaker will then be transcribed automatically. Thirdly, we measure students' creation based on a full range of criteria rather than a single numerical score or grading. So assessment rubrics, which was created by me and reviewed by the Dr. Chu and his research team, as well as our colleague in Hong Kong U, was disseminated to the registrants. The same assessment rubrics will be used by the international competition judges and also all the parents who wanted to have a more understanding about the competition. So yeah, okay. So I will provide the information in the Zoom chat for everyone who is interested to invite your students of your countries to join this competition. Thank you so much.
Okay, now besides the story writing, yeah, the other two strategy were to guide students to create questions for their own story. So that's called competing with Socrates, because Socrates is good at teaching with questions. And then the third one is we'll create a lot of questions based on our video, and then have a battle on that, challenge students with that. So with these three strategies, we hope that our very nice video will be well used. Thank you.
Thank you, Dr. Sam and Ms. Helen Chen. You have nicely described that how students get the help out of that your video, and you have done tremendous jobs. Thank you very much. My next question is to Mohammed Anwar Islam from Bangladesh. Can you reply? How does the ASSIST special project support the community people fight against COVID-19? And how do you feel the COVID-19 content in the local language helps people to get and use COVID-19 information? And also, how can the ASSIST South Asian YouTube channel help the community people combat misinformation about from the existing sources of WHO or CDC? Mr. Muhammad Anwar Islam, please.
Thank you, Dr. Debel. So the kind of questions, if I summarize all those questions, it relate to like three things, like the project, COVID-19, as well as the language we created and how our YouTube channel is helping, all those things. So I guess like the other team members and the project lead can sum up with all the other things. But for me, what I feel like I would like to focus in my country context, some things, because I've been working from Bangladesh. So the reality is that like our life has been halted over the years under the different variants of COVID-19. After the Delta variant, we are witnessing the Omicron. And in a recent Nature survey, it is found like scientists expect that the virus that causes COVID-19 will become endemic. Means it will continue to circulate in a pocket of the global population for years over time. So we need collective efforts and research. So for me, health information literacy, content creation during the COVID infodemic is another feeder with the WHO, CDC, and other organizations that helps to fight against the contagious virus in the South Asia region. So while South Asia is one of the most densely populated regions and having low testing rates and is considered highly vulnerable to any large-scale outbreak of infectious disease, by reaching community people through workshop, the kind of workshop we are doing, the kind of webinars you're organizing, and the sort of panel discussions, and the creating COVID contents in web, I feel that we are creating value for the community people. I hope I addressed the areas like how our project is creating value for the community people. And if we context on the second part, like the local languages, I'm sure like creating contents on local language is always a like great job for the community people. Sorry, community people. In the context of Bangladesh, if you see like one of my great regrets is that being like monolingual, because most of the population speak, read in one language. So the moment they start failing to find information on website, they feel some sort of like limitations, and for overcoming these limitations, what happens like some government websites and NGOs are creating Bengali contents on COVID, but the number of contents, videos, resources are limited, and I should say like very low compared to the English contents if we make a search in Google. So reaching people in a language they understand and trust, and play is a significant role in supporting better outcomes for an epidemic crisis like this. So the contents we created in 5 languages, and I had some sort of informal conversation with some of my neighbors in my villages, and because I feel really thrilled to be a part of this like wonderful project, and I always try to like get their feedback and suggest them to watch our YouTube channels and all those things. So what the response I got from them, like they're delighted to hear, watch, and get the COVID-related contents and information in Bangla. And from Bangladesh, the part like I contributed here, like translating all the English contents in the Bangla languages. So even it raised people's awareness in the linguistic diversity in the region. One elder explained the importance of hearing his language in a video by saying he's up to date. It means like he's no longer backward or excluded community, because the moment they see the video in Bangla, the moment they see all the narrations written in Bangla, they feel more comfort. They feel more like close to the information of COVID-19. So apart from that, what I did, I had browsed and checked YouTube for COVID-19 related contents in Bangla, in the YouTube channels, in the YouTube. But this is all full of discussions and meeting awareness campaign, health talk, and related clips to the COVID-19 hosted by TV channels, particularly in Bangladesh. But the way our YouTube channel, like Assist South Asia, created and compiled all the contents seems have some sort of flow of information, COVID-related information. And the good part of these resources are that each video contains authentic research and health-related information. And finally, the understanding I have in my mind, like one of the most unpredictable aspects of the past 2 years and one of the most disheartening news is that the rise of widespread misinformation. And our project, what I believe, is like creating value or fighting against the misinformation, helping. The line between facts and the lies has disintegrated. The power of misinformation can be seen in the number of people appearing in hospitals and desperately stick with COVID-19 and struggling to breathe, who still says it's a hoax and don't believe that this is an actual virus, like many other viruses people used to have the experience. In the first 3 months, like according to the source of WHO, in the first 3 months of 2020, nearly 6,000 people around the globe were hospitalized because of coronavirus misinformation. Recent research suggests, as well as South Asia YouTube channel, help the community people combat misinformation apart from the existing sources of WHO, CDC. In Bangladesh, YouTube is one of the popular media, and I'm sure the final outcome of this project would bring considerable benefit for the Bangladeshi people and South Asia region as a whole. Yeah. Thank you.
Thank you, Dr. Anwar. Thanks for excellent jobs done. And it's of course true that misinformation is giving huge problem, and also the number of informations coming from different way. So that's creating a problems. Thanks anyway, as you telling that YouTube is giving lots of informations. My next question is Dr. Bhakti Gala from India. How was the Assist special project perceived, and what are the challenges in creating accurate multilingual content for COVID-19, especially from India? Dr. Bhakti, please.
Thank you. Thank you, Dr. Debal. This project, of course, has been conceived in the background scenario of the COVID pandemic as well as the COVID infodemic. I believe that the world is fighting two wars, the obvious war against not only the virus, but also the information one chooses to believe in and act upon. People's response to the pandemic is directly influenced by the information, misinformation, and disinformation surrounding COVID-19. In April 2021, against the call for funding for worthwhile projects, which was issued by the Association for Information Science and Technology, members of the Assist from 3 chapters, that is the South Asia chapter, the Asia Pacific chapter, and the Europe chapter, actually volunteered and convened to discuss the creation of content to address this COVID infodemic. Over a period of 1 month with more than 7 meetings, members finalized the broader objectives and details for the implementation of this project. The main objectives, of course, of this health informatics project, as we have already stated on our website, dealt with spreading awareness about COVID-19. We also wanted to exchange and share experiences of countries who have already experienced previous similar such viruses. We were going to kind of identify topics, pertinent topics for content creation for our videos as well. And then the most important, as we mentioned today, is to share accurate and reliable information. These were the main objectives which we had started out with. The Assist for South Asia chapter, of course, won this project award. And as a project lead, since its implementation, which began in July 2021, I, along with my team members, have been meeting regularly, almost twice a month, resulting in the content creation of currently 9 videos, which have already been uploaded. The main goal of the project is to create 10 videos on these topics, which we have discussed among ourselves. And the idea, of course, is to ultimately aim in making a small difference towards this, creating awareness of accurate content. The topics of these videos, as mentioned, are very general and are selected on the basis of being able to reach out to the masses with samples such as myths about vaccines or myths about COVID-19, basic facts about vaccines, post-COVID complications, precautions. We also have a special video on strategies to control COVID-19 infodemic, and an upcoming video we have on variants of the COVID virus also. In one of our videos, that is, how things to do during the pandemic, where we collaborated with the Asia Pacific chapter. We also, each country members even shared numbers and helpline numbers of the mental health institutions. These were added to our videos so that the audience could benefit from these. And these have all been uploaded on our channel, as the links have already been shared in the chat box. These videos, of course, are available in 5 languages. We have collaborated with multiple associations actually, and the competition which was discussed by Sam and Helen is the result of one such collaboration that we have done. The challenges which were faced as far as coming to that aspect when we talk about it, not only were the challenge of language was one of them, but I'll begin with 3 major challenges which we faced during this project execution part. One was, of course, the content selection. The video content topics which we were deciding were through common discussions relevant to the prevailing situation. Teams were formed to write the scripts, and as the COVID situation kept on evolving, the topics were also being modified and updated, for data also. For example, a video on the variants was suggested by a team member after the onset of the 3rd wave fueled by Omicron. And in addition to these, we also thought that we should add videos on mental health and loneliness, because that was also a major issue which was happening with many of us. And then it was also decided, as my colleague, Dr. Anwar also suggested, that although we were kind of looking at accurate websites such as WHO or CDC, but at the same time, we also wanted that websites from the health departments of the respective countries, of all our participating members would be consulted and would become one of the sources of our videos. And these sources would also be cited at the end of every video. And the content of the creation, of course, went through multiple checks and multiple drafts and revisions creating. So we were working on a strict timeline because the project is essentially for a 1-year period. And as I mentioned, we have already uploaded 8 videos, and the 9th one is being worked on. Translation, of course, one was a major issue, especially when it comes to languages. We had the constraint of the project budget, and we had decided to select only 1 language from each of the participating country, as we already had members in the project from Bangladesh, Pakistan, Sri Lanka, and India. 4 languages from these countries were selected. This was a challenge, especially if I must consider my home country of India, where we have almost 22 official languages. So I chose Hindi as the language from India, but knowing very well that there are many more languages in India where translation is required. And I have received many such responses from different parts of India, where people have asked me that whether we would be considering translating these videos into other languages, and if time and finances permit, we will consider them. Bengali was selected, as Dr. Anwar said, from Bangladesh, Sinhala from Sri Lanka, and Urdu from Pakistan. The original script, of course, is being prepared by in English, and these were then translated into the respective languages. Voiceovers for the videos were undertaken, which was again a challenging aspect for us. It also meant that the video descriptions which we are adding to the channel have to be also again translated into the respective language. We are creating special playlists for each language so that different users of different language can directly go to the playlist and access the video content over there. For us, this was also a challenge, because many of us were also new to YouTube as a platform to work on. So for us, it was a learning experience. We had to learn new technologies and concepts, and the younger members also chipped in and helped us with that. Last, but equally important, were the strategies to promote the content. The team, of course, decided that the primary channel for promoting the video would be through the YouTube channel, and with further promotions which are happening through our own Assist South Asia chapter page. We have also tried to reach out to more than 450 plus associations and also NGOs from all these South Asian countries where members are already participating in our team. We have sent them emails to letting them know about the channel and the content. We've also been organizing different webinars to date in different countries. Each team member has used the print media also in their respective countries to promote the channel with this content. And to finally address the digital divide, which is prevalent in the rural areas in most of the South Asia countries, we are currently actually planning to arrange for the showing of these videos in rural areas of all the 4 countries where internet connectivity is an issue. So this is my summary and intake of summary of the kind of project and the challenges we have addressed and faced as a project lead. Thank you so much.
Thank you, Dr. Bhakti Gala. Yeah, you are right to say correct information, accurate information is very important. Also promoting the methods about the information COVID-19, it's very important. And thank you very much. Now turn is for Dr. Syeda Hina Batul from Pakistan. You may talk about replying the questions. How many COVID-19 waves have Pakistan experienced? And what could be the most important reasons or factors? Is it beneficial to educate people in the local language and through the videos? And what could be the possible plan to outreach created content in the neglected areas of Pakistan? As you already told, that neglected area in some Pakistan is facing more problem. Please, Dr. Syeda Hina.
Thank you, Dipal. As far as the waves information have been concerned, so in the first part of the panel discussion, I already told to the audience that we are currently facing the 6th wave, which is more than the other countries of SA and the global countries, other countries of the world. So I would like to answer the question, which is basically related to creating content in videos and through visuals. That why it is important, because our project members all conceived the idea that we should go for YouTube or creating the videos. So Bhakti, Sam, and Anwar has very much described the basic aim of doing that. So what I was thinking initially when we were deciding or conceiving that this should be in terms of a YouTube channel, that we have to, create health literacy content in terms of videos. Because I know that we are currently living in an information visual world. And studies which I read and others related literature also confirm that visual information is more powerful than the text and the words. I was reading one of the literature that one education consultant talked on that, or argued that visual information directly processed into our permanent memory and stayed there for a longer time. However, on the other hand, when we are reading text and reading words, so they go directly to our short-term memory, and they retain there because the space is not very much. So they only the 7 bits of information can retain there, and rest of the information deleted. So this was the, I think, basic motivation behind creating this type of visual content for the purpose of health promotion. Secondly, visual information processed 60,000 times more in our brain than words and text. So this was the basic motivation that, learning through visuals and how much it is important to create health information literacy content in terms of videos. So keeping in mind, we targeted YouTube channels and videos. Now, let me tell you some of the situation of video users in Pakistan. I can not talk about the rest of the world, but Pakistan, as far as Pakistan is concerned. So we have currently more than 89,000 Facebook users. However, the statistics related to YouTube is 0.89 only, but this doesn't mean that people are not watching videos, because YouTube is not the only source from where the people are channelizing the videos. So, for example, personally, I saw in my surroundings, my own children, my elder parents, those used to attach very much with the with videos. They watch videos for the purpose of entertainment, for purpose of taking information, for health related issues. They usually watch videos. So this was the basic idea. And when we have a committee meeting, project committee meeting, so I always promoted, to go towards making videos, because this is a very interactive medium to aware people regarding their professional as well as their personal information needs. So, and people are very much users of Facebook and Twitter in Pakistan. So they are coming channelized, the videos are channelized from YouTube and Twitter. Now, let me highlight some of the benefits of creating videos in local language. Anwar already told some of the things related to this. Definitely, Anwar said very rightly that when we create a material in local language, so our learning becomes fast. We learn more faster than the other languages, and the learning becomes effective. Studies also confirm this aspect, that when we learn in our local language, so our learning is very much effective than learning in international or other languages. Similarly, people also agree that giving feedback or reflecting your own opinion in local language is also better. So that's why we thought to create, in our project, we thought to create material in different languages of South Asian countries. As Bhakti told you, that due to budget and time limitations, we could not, canvas all languages of all different countries, but we did the maximum try to, to take up all the popular languages of different countries. For example, Urdu is national language of Pakistan. So we created and selected Urdu from Pakistan. Urdu is national languages of Pakistan. However, it's 230 million people in the world actually speak Urdu. So it's not only that we targeted the people of Pakistan, but actually we targeted 230 million people who are living globally. And YouTube is without any geographic restrictions. So YouTube can go everywhere. So we targeted 230 million through one of the language. And our purpose hopefully is will be successful when it will outreach more and more. Now, I would like to tell some more things. When I was creating videos or translating videos in Urdu, some of the problems actually happened to me. For example, Urdu is not very much available in all of the softwares, built-in softwares related to videos. So there I had some hurdles, but we overcome it by using some voiceover. I personally did some voiceovers for the videos to overcome this. And I was not very much familiar in Urdu keypad. And during this project, I learned that I used to the Urdu keypad, and I translated all of the videos which we have created in this project. So this project is not only one thing, it is full of learning, technological learning, as well as Bhakti already mentioned it. Now I would like to tell some of the strategies which we can adopt to reach out the people in neglected areas of Pakistan. Although our project members already planned so many activities in terms of webinars, in terms of, as Helen and Sam updated you, that we conducted many competitions or did some of the workshops in different times. Okay. So what we can do, we can reach out the faculty, we can reach out through these videos by accessing students. For example, I give you my personal example. I'm teaching a course of research methods, and I asked my students to show these videos to the neglected areas to 6 people who are in close connection to you and take their feedback. So similarly, recently our channel statistics are going very up, because the students watched the videos, they downloaded it, and they asked their close relatives to watch it. So I think this is the main strategy which we are which we can opt at all levels and our personal level to reach out the people in neglected areas of Pakistan. Thank you.
Thank you, Dr. Seda Hina. Yeah, you are rightly saying, and that YouTube channels and video makes impact to the peoples, and also the local language give also more effective. And you also told that that it is make affected in your country and even in the neglected areas. Thank you. Now, Prasadi Kanchana Jayasekara from Sri Lanka, you may please talk by replying the questions. What are the challenges faced during creating content in Sri Lanka, and how do you overcome those challenges? And what are the marketing strategies you use to market the ASSIST South Asia chapter YouTube channels and its contents? Prasadi, please.
Hi everyone. So I'll first answer the first question. There were quite a few challenges I faced when creating content in Sinhala. I will share a few significant challenges and how I overcome those challenges. First of all, I will share some information on Sinhala language. Sinhala is an Indo-Aryan language primarily spoken by the Sinhalese people of Sri Lanka, and it is spoken by nearly 16 million Sri Lankans. So a small number of people in the world can speak and understand Sinhala language. So our video production company is a Pakistani company, so they were unable to understand Sinhala. Because of that, we faced a problem creating content in Sinhala. This was the most significant practical challenge I faced. To overcome this, I had to learn video editing and add Sinhala voiceovers to videos and edit by myself. The learning of this video editing process and familiarizing myself with with these software tools took a considerable time. The second challenge was finding Sinhala voice artists. The Pakistani video production company we hired did not have any Sinhala voice artists, so I had to find voice artists from Sri Lanka. Also, when we were working on the first few videos, Sri Lanka was under lockdown. So at the beginning, it was so difficult to find proper equipment such as good quality mics to record Sinhala voiceovers. Since we did not have any other option, we had to use our mobile phones to record voiceovers. The third challenge was finding Sinhala words for some technical terms. As an example, there is no direct Sinhala translation for infodemic. Because of that, sometimes I had to get help and advice from experts in Sri Lankan library and information science field to find the most suitable Sinhala translation for those words. The fourth and final challenge was compatibility of the video production software with Sinhala language. Up to fifth video, we first created the English version of the video and added voiceovers of other languages to it. So even though the audios of those videos were not English, the text in the videos were in English. From the fifth video, the video production company found a way to create text not only in English, but also in Hindi, Urdu, and Bengali. But the software used for creating videos do not support Sinhala fonts. Unfortunately, I could not find a way to overcome this challenge. So now I will go to your second question, the marketing strategies we used in this project. Marketing plays a very important part in this project because there are a lot of COVID-19 related videos available on YouTube. So we had to market our content to get the attention. Also, our YouTube channel is a very new one. We started it on 24th August 2021. So we had to build it up from the zero. We mainly focused on three groups in our marketing campaigns: the general public, individuals, and professional bodies related to library and information science. We use several ways to market our videos. First, we use social media marketing. Mainly, we focused on Facebook, Twitter, and WhatsApp. The most prominent one was library and information science related Facebook groups and pages. On the social media platforms, we shared a short description of our video along with the link to the YouTube videos. Secondly, we used emails to share our YouTube channel and videos among library and information science professionals, library and information science related professional bodies, and NGOs. To make this process easier, we subscribed to the mail merge platform, YAM. The third way was webinars. Our project members in India and Pakistan organized a series of webinars in collaboration with library and information science organizations and universities in their respective countries to promote the project, YouTube channel, videos, and the International Digital Story Writing Competition. There will be more webinars organized from the project members in Pakistan and Sri Lanka in the upcoming months. The fourth wave was the International Digital Story Writing Competition. This competition is an extension of the project to capture the children's imagination on COVID-19, AI, and robots. During free workshops organized to help students prepare for this competition, Sam and Helen will teach competition participants how to learn the art of creating questions using the videos created in this project, which will increase the usage of our videos. Finally, we are planning to use blogs to promote our YouTube channels and videos. Blog post will be written to give an overview of each video and shared on the Assist South Asia chapter blog. This is still at the initial stage. As a result of this marketing campaign, currently we have more than 160 subscribers, over 1,500 views, and 26 watch hours. So I would like to invite all of the colleagues present here to watch our videos, share those with your friends and family, comment and subscribe to our YouTube channel. Thank you.
Thank you, Prasadi. That's mean you have faced many problems during that year and try to overcome. That's the challenges you have faced. Also, but the marketing strategy you have taken, it is right. That's well received, I found. Thank you. Thank you, everyone, for nicely replying the questions, and the project you have done, it is excellent. So now I can open the sessions for question answer. I am, as of today, now there are 2 questions. How we can improve our service during COVID situation? That's the first questions. The attendee is not giving his name. And the second questions, please suggest any model for COVID-19 pandemic accurate information in Indian scenario. So Bhakti can reply this?
Okay, yeah, thank you. I believe Dr. Mahendra Kumar is asking this question. Any model for COVID-19 pandemic accurate information? I think we cannot really talk about any one specific model. You need to have a combination of sources, I feel, for getting accurate information, because information is not limited to any one place. But as we suggested and as we did in our own project, is where we looked at we identified essentially the international organizations which were accepted and acknowledged by the global world as accurate sources for information, for example, WHO or CDC sites. And as far as where India was concerned, we were looking at information which is being given out by the ICMR on a very regular basis, or even by there are major news houses also which have come out with COVID fact checking sites, initiatives also COVID, because there is a lot of myths or very wrong information being shared about COVID. So I have come across multiple news media houses which have started these initiatives to essentially, which are called as fact checking or myth busters, so these essentially are helping us to identify wrong information which is being circulated regarding COVID-19. So I would suggest that we cannot have any one model. We need to have a combination of multiple models. So you can have it at a 2-tier or a 3-tier level, where you have international sources, your country level national sources, and then maybe your regional, because COVID develops and evolves differently in each region and small areas. So we need to be tracking all of these to actually come at a concise view of what is happening and how to deal with it. I hope that has answered your question.
The first question was, thank you very much. And the first questions were how we can improve our services during COVID situation. Can any panelist wish to reply this?
I'm actually trying to understand what does it mean by services? Is it from the perspective of a library?
I seem so, Bhakti, because the way it is like incomplete things, probably the audience is asking like the way library could improve their services during the COVID times. This is sort of questions.
I'm hoping if that is the correct one, because I would not like to end up giving a very wrong answer. And I think each one of us can maybe share a little bit about it, because libraries have gone all the way out as far as services are concerned. And maybe if Anwar, you would like to share something from Bangladesh and what libraries are doing.
Thank you, Bhakti. For me, the experience I had, because that I haven't any practical experience working in the library things, but the moment I start doing research in the pandemic times, what the libraries are addressing in Bangladesh. So the moment I do search in Google and some leading databases, I found some articles and got like very few private university libraries, I must say, not the public universities. Private university libraries, they are really doing well. What they did like set up information literacy model, how to spot the fact, how to spot the fake news things. They bring up the IFLA infographic things on their websites, so that the person, because they're not visiting to the library in person, the library is closed. So the way the user visiting the library, they get informed during the COVID time, how to get fight with that things, as well as a paradigm shift has been happening in the library sectors. So the way they purchase the printed materials the earlier times. So after March 2020, the number of using ebooks things increased. So they put more priority on the e-resources things. But as what I said to you earlier, it is mostly very few leading private university libraries cases that I noticed, the experience I have in Bangladesh.
Thank you. I think there is another question. Is there a library providing health information literacy in India? And is there any difference between health literacy and health information literacy? So it is related to India. Can Bhakti reply?
Yeah, sure. I'll try my level best. I'm not able to say whether there is
before that, I just wanted to say that many information is giving, like you already told that medical library, they are also providing this from National Medical Library, also AIMS Library also providing this type of information, as I know, but you can reply if you know more.
I was going to suggest AIMS itself and the ICMR website. These are two main sources that I have consulted as far as health information literacy, with particular to COVID, is concerned. In India, this is it. And of course, WHO has also started a course on health information literacy, which is just recently launched, I believe, and it's open to all. So that, of course, although not specific to India, but then this is something which is applicable to the whole world. So I don't think it's very country specific, health information literacy. Regarding the second question, is there any difference?
Can I answer?
Yeah, sure. Thank you.
Thank you for the question. This is actually related to the question, or someone is asking regarding health literacy and health information literacy, because information literacy is my major area of research. So that's why I try to answer this. As far as I read, health literacy is basically coming from the literature of medical sciences. Most of the medical scientists, nurses, doctors who worked or who researched on this aspect, they use the term health literacy. And it is started similarly when the information literacy term coined in 1974 by Zorkowski. So it is at the same time, this term coined and started using in the literature of medical sciences. So when this literature, this sort of concept has been realized in library and information management, then they connected it with actually that it is health information literacy is the complete concept, health literacy only, because there are multiple literacies type. So the information management researchers or library and information science researchers realized that it should be connected with the term information. like information literacy. So this is something, health information literacy. I hope I answered this question.
Yes, thank you. Another question, and that's the last question. How do you identify where and how misinformation circulates in the community online and offline? And also, it seems that a lot of content dissemination channels mentioned are digital and require internet connection. And you have yet to mention how you minimize exclusion caused by the digital divide. So that already mentioned someone. So how do you get the information to the people who do not have access to the stable internet connections? So anybody can reply this?
Okay, as I had already mentioned in my talk previously, that we did realize that there is a huge digital divide as far as the South Asian countries are concerned, where there are major rural areas where you do not have proper internet connection. It's very poor internet connection. You also have people who do not have knowledge about YouTube as a source of information. So to overcome or to cater to this kind of audience, what we have planned currently are to take our videos to the rural areas, as Dr. Hina just suggested how she told her students to take the videos to rural areas and show them in the language. So that is what we are all planning in our individual countries. We are identifying, currently we are in the process of identifying bits and small pockets of areas where the videos in the respective languages will be shown. We are collaborating with NGOs who are working in these remote locations, so that our videos can be shown. We will be pre-downloading our videos, anticipating that there will not be any internet connection over there. And that is the one way we hope that we will be able to show these videos to the different areas and address the digital divide. I hope that answers your question.
So there are two more questions. That is, why health information literacy to the LIS curriculum? In many countries it is there. So many countries can introduce, but we cannot. IFLA can suggest also to include that, include in the LIS curriculum. But another question is how we can connect general people to connect information in the context of Bangladesh. Is Muhammad?
Yes. Yeah. So it's me from Bangladesh. Yeah.
We will not take any more questions.
Okay. So we do not have any gun to shoot misinformation or fake news things. And there is no certain mechanism that can stop things. So it is the people who need to be aware on that, who needs to know. It is not like a ready-made food, someone prepared, you will have it. So if you want to believe information on net, on book, or anywhere in the world, you have your critical analysis things. There are certain mechanisms, there are certain tools that you can apply. And we have been talking over the years and different sites and different websites, different newspapers, even in our projects, we've been talking like how to fight with the misinformation and disinformation things. And particularly, it is not in the context of Bangladesh. Overall, if people want to get aware and to fight with fake news, mis or disinformation, they need to know how to use those tools. They need to be aware of using those tools. Only that time it is possible to combat with the misinformation things.
Thank you. We will not take any. So we want to end this session. The time we are facing because of COVID-19 is very, very difficult for all of us, whole of the world. It is not related to only one country. And health information literacy project and this panel discussion contents creating by the COVID Infodemic was very useful. And these discussions also, I think it will be very useful to those who attended, and it will be others people also. It is very important to spread the awareness about the COVID-19 and issues and its behavior, sharing the experience of the different countries, how each of the country is facing and how they are fighting against them. With this, we want to end these sessions, and thank you all the participants. I also again thank you the organizers for this webinar, for inviting me as moderator and to be part of this wonderful program. Thank you all the speakers. Now I hand over the organizers if they wanted to say something.
Sure, thank you everyone. Just a wonderful session. Please follow back up on our IFLA Science and Technology Library Sections YouTube page for the recording, and also on our events page on IFLA for our future presentations. Have a wonderful day, everyone. Thank you.
Thank you. Thank you, everyone.
Bye. Bye.
Everyone.
Bye-bye.